And welcome. Thank you for joining us this afternoon. My name is Taylor Morton, and I am the Advocacy Specialist at the Alliance for Healthy Kansas. The Alliance is a nonpartisan, nonprofit organization focused on policy education, advocacy, and organizing, with the primary policy goal of expanding KanCare, which is our state's Medicaid program. We are a coalition of more than 125 organizations and thousands of individual advocates across the state of Kansas. Today's webinar was designed to provide the latest information on KanCare Expansion. We'll be discussing the Alliance's 2023 briefing book on KanCare Expansion and how you can use this resource. We'll also be presenting the latest findings on how expansion will benefit the behavioral health system in Kansas. As we're speaking on these topics, please put any questions you have in the Q&A and we will answer them at the end. Without further ado, I will hand things over to the Alliance's Director of Communications, Lacey Kennett, to talk about the 2023 briefing book on KanCare Expansion.
Hello, everybody. Thank you, Taylor, for introducing and getting us kicked off here. So we are really excited today to take you through one of the resources that we have that has all of the things that you might need if you want to know about KanCare Expansion, if you want to talk about it. So we're really excited to go through this with you today. You can see here on this screen, it's kind of an overview of what I'm going to talk about, which is basically walking you through the book. So if you're so inclined and want to pull it up during this webinar or after and look at it, that would be awesome. You'll be able to see what we're talking about. So we're going to go through some of the talking points that we know to be particularly relevant to the conversation about KanCare Expansion right now. And at this point in time, we're going to go over some stats and facts at both the county level in the state and from other states and on a national level, and then introduce you to some of the storytellers that we have here in Kansas who are also featured in the book. So first, I'm going to tell you how to find this. So we are really excited about this. We have a brand new website as of the beginning of 2023. This is what it looks like on our homepage. You can see here on the left, the red arrow. If you click on Learn More, that will take you to the resources that we have. It includes not only this document, but if you scroll, tons of handouts and fact sheets, along with links to studies and other kind of data statistical information. So we've got tons of stuff there. I hope you'll go check it out. But you can see on the right-hand side of the screen, the red arrow, that is the document that I'm going to be talking about. And then I did sneak in that green arrow, which links to the study that our executive director, April Holman, will talk about here in just a bit. So if you want to find it, that's the easiest place that you can find this. The first three resources we have here in the briefing book are on this page. You can see we have here on the left-hand side a timeline of expansion in Kansas, and we try to include, at least in the recent years, what has happened in the legislative session as far as expansion is concerned. So kind of the timeline from when the Affordable Care Act was passed all the way through present day now. In the middle there are some quick statistics that you might find helpful. So if you're looking for the number of people who would benefit from expansion, or the amount that the federal government covers of the cost of studies associated with expansion, you'll find all of that there. And then on the right-hand side, just some quick, fast facts that will give you kind of a high-level view of what KanCare Expansion would do for our state should it be passed. So that's kind of how we start the book out. What I'm going to go over today briefly here are 6 of the major reasons that we believe Kansas needs KanCare Expansion, and I think they're all very salient and relevant for what's happening today. So we'll kind of talk about those in detail, but here they are listed. So reducing healthcare costs for everyone, protecting Kansans from medical debt, fixing eligibility limits, which are too low, protecting and strengthening rural healthcare in communities, keeping Kansas economically competitive, and helping with general workforce issues. Let's start with reducing healthcare costs for everyone. I think that's something that most all of us can relate to, right? So uncompensated care remains a bigger problem in states like Kansas that have not adopted expansion than in those that have. If you're not familiar with the term uncompensated care, don't worry. Uncompensated care is basically any care or services that are provided that aren't paid for or reimbursed, usually because a person doesn't have health insurance. So uncompensated care remains a big problem in Kansas, and expanding KanCare would allow those previously uninsured people to access that care that they need and reduce those uncompensated care costs. High uncompensated care can result in the costs of healthcare going up for everyone, even those with insurance. And so this coverage that can cover those who've been uninsured can help bring those costs down for everyone. KanCare Expansion can protect from medical debt. So almost half of Kansans have medical debt or know someone who does, and it's one of the leading causes of bankruptcy. And notably, in states with expansion, new medical debt dropped by 44% when compared to non-expansion states, which saw a 10% drop. So we're talking significant difference in new medical debt accrued. But not only that, it reduces the number of short-term payday loans, it improves credit scores, and just generally improves social mobility so that people can stay out of medical debt and they can use that money for other things that they need. Also fixes eligibility limits, which are too low. So in Kansas, an adult without either a disability or without dependent children in the home are never going to qualify for KanCare. If you do have dependent children at home, you can't make more than 38% of the federal poverty level, which in 2023 is about $9,500 per year. And that takes into account that you have to pay for housing, food, all of the other things. So this is a big deal because expansion would raise that 38% and allow, say, a single mom to either work more hours or get a higher paying job without losing that health coverage. It is also important to note that an estimated 75% of Kansans with disabilities do not qualify for KanCare right now. So that might be someone who has a disease that's progressing but doesn't yet meet the legal definition of having a disability. So that allows them to get preventive and ongoing care and can really slow the progression of that. KanCare Expansion would protect and strengthen rural healthcare. So according to the Kansas Hospital Association, since 2010, 5 rural hospitals in Kansas have closed. We have more rural hospitals at risk of closing in Kansas than any other state our size. In fact, rural hospitals in non-expansion states like Kansas are 6 times more likely to close than rural hospitals in expansion states. And this is demonstrated, like the benefit of expansion to the rural communities is demonstrated through North Dakota. So North Dakota expanded their Medicaid program in 2014. And since then, they've seen it become a vital part of growing the next generation of farmers there because it eliminates the need for an off-farm job to provide that health insurance, and it really allows those individuals to focus on the farm. And so this is just one example of how expansion and a healthy rural healthcare system can really benefit the community because, of course, that is so much more than just healthcare. It is also a driver of economic security in the community and things like that. So KanCare Expansion would keep Kansas economically competitive. So as you may know, all of Kansas's surrounding states have expanded their Medicaid programs, which means if a business is considering locating in Kansas, they may choose to just jump over the border to one of our bordering states and open there instead because of all of the benefits that expansion brings. Additionally, for small businesses, expansion could provide coverage for small business employees, making those small businesses better able to compete with larger businesses for when they're looking for employees. And of course, healthier Kansans mean healthier employees. And expansion would help the general workforce issues. I know this is a topic that we've heard a lot about recently, which is why we wanted to include it. Now, here in the first bullet, I've included kind of 4 categories that would have benefit a great deal from expansion. Now, nearly every industry in Kansas would have some sort of benefit, but I want to focus on these. So food services and retail workers, there are about 42,000 Kansans that would benefit in that category. In the healthcare and social assistance, about 18,000, education, about 17,000, and manufacturing and construction, another 26,000. So if you look at just those 4 categories, that's more than 100,000 Kansans that would benefit. It would also provide competitive and integrated employment opportunities for people with disabilities. And in that, personal care attendant and direct support workers, of which we know Kansas has a shortage, this would be a critical component in keeping that workforce healthy and keeping, having enough of those. So I wanted to put all of these pictures in this because we absolutely love our storytellers. We have a group of Kansans who have spoken out about how they are passionate about KanCare Expansion. Some of them are individuals in the coverage gap. Some of them are healthcare providers. We also have business owners. We have faith leaders. We have all sorts of storytellers, but these are the storytellers that we feature in our book. So I just wanted to include them and kind of give them a shout out. Moving on in the briefing book, we have a couple pages dedicated to other state outcomes. So one of the very few benefits of being one of the last states to expand our Medicaid program means that we've had a lot of time to watch other states and what have happened. So I just wanted to highlight 2 of those. We go over a lot more than that in the book, so I hope you'll check that out. But I wanted to talk about 2. Let's start with Louisiana, which passed expansion in 2016. Since then, they have generated new revenue for their healthcare providers. They've saved the state general fund millions of dollars and seen a huge reduction in the number of uninsured people in the state. The other state that I wanted to highlight was Kentucky. So Kentucky passed Medicaid expansion in 2014. And just like Louisiana, they saw a reduction in the number of uninsured, but they also had millions of dollars in savings in uncompensated care. And most of the money that they received has gone straight to those who provide healthcare services. So your doctors, hospitals, pharmacists, and other people like that who provide care. We also, in the briefing book, have county level data. You can see here on the left, this is what it's a double page. You can see here by county, the number of new jobs that would be created under expansion, as well as the new annual healthcare spending by county. If you are interested in this county level data, I did want to include on the right-hand side, this is not part of the briefing book, but we have this resource on our website in the same area. You can actually download fact sheets by county, and it gives you even more information about how expansion would affect the county. So if you're interested in that county level data, we've got that and would welcome you to take a look at it. As a general communications principle, as somebody who thinks about that and works with that, we know that combating misinformation by repeating it is not necessarily an effective messaging or communicating tool, but we do recognize and get requests for people wondering, I've heard some of the opposing side arguments and I'm not totally sure how to address that and how to talk about that. Can you help? So we do have one page that's kind of dedicated to pushing back on some of those arguments that you might hear. So you can find that also on page 25 of the briefing book. We also know that the federal landscape has been changing and continues to change. So we include a page in the briefing book about that. So you can see here in this graphic, the states in green have passed Medicaid expansion and the states in blue have not. South Dakota being the most recent state, which last November through a ballot initiative passed expansion. So they got to go from blue to green. We also hear that North Carolina is on track to do the same thing this year. So that will reduce the number even more. But I mean, this page will talk to you about the federal signing bonus that Kansas would get if we expanded, which would be up to $450 million in the first 2 years. And also with the ending of the COVID public health emergency, there will be a lot of redeterminations of Medicaid eligibility this year, starting very soon. And so we will see a great deal of people coming off of that coverage. And that just makes the need for expansion even greater as we see that churning and those people losing coverage. So now I'm going to pass it over to I'm going to give it back to Taylor, I think, and she's going to take it from here. Is that right?
Yes, no problem.
Okay.
Thank you so much, Lacey. And like Lacey said, you can find the 2023 briefing book on KanCare Expansion on our website, which is expandkancare.com, and you'll find it under the Learn More tab. So here to speak with us now on the impact of Medicaid expansion on the behavioral health system in Kansas is the Executive Director of the Alliance for Healthy Kansas, April Holman.
Thank you, Taylor. I just wanted to say first off that there have been some great questions in the Q&A, and I tried to answer some of those before it was my turn to talk. We're definitely going to get to those at the end. So please keep putting your questions in, even if we're not answering them right away. We definitely will be talking about that at the end of our time together. So if you would advance the slide. So I wanted to tell you a little bit about a new report that was just issued by the Kansas Health Institute. We actually commissioned this report, and the reason that we were trying to get more information was because there has been a new policy put in place recently as it pertains to behavioral health. It's called the Certified Community Behavioral Health Clinic model, or the CCBHC. And I think that there was a lot of confusion, not only among advocates, but also among policymakers about how that could potentially help if we don't have expansion versus if we do have expansion. And so that was one of the main reasons why we decided to ask for this report. And we also thought it would be really helpful to identify the anticipated dollar amount of increased resources for behavioral health providers if Kansas were to enact KanCare expansion. If you could advance the slide, please. And so, you know, the report did identify that it answered the questions that we had hoped, but it also found a lot of interesting information that we hadn't necessarily anticipated. So I want to give you the highlights of both of those things and then really encourage you to take a look at the report in more detail so that you can get a better understanding of how this is important, not only in maintaining physical health for people in the coverage gap, but also in helping them to have their behavioral health needs met. When we talk about behavioral health, we're really talking about a combination of mental health and addiction treatments and care. So it's really, that is the full picture of what they were looking at in this report. And what they found was that, as you might expect, expansion would increase resources for behavioral health providers in Kansas. It would increase the number of behavioral health providers accepting Medicaid patients, and it would increase the number of visits per user of behavioral health services. And I might just add that this is all based on the actual experience in states where they have expanded. And if anything, I think these are conservative numbers in terms of what would happen here as opposed to what has happened in those states. Next. So some of the direct impacts on providers in the findings of this report are that of a total of about 108,000 adults who would be expected to enroll in Medicaid if we were to expand, about 24,154, or about 22% of them, are likely to use behavioral health services once enrolled. So when we think about that, there is a lot of pent-up demand for this type of service. In some cases, those individuals might already be receiving care, but they're just not able to pay for it. And in other cases, those are people who really aren't seeking out the help that they need because they know they can't afford it. And that's something that we see not only in behavioral health, but also in physical health in Kansas. Many Kansans don't want to seek care if they know that they're not going to be able to pay their bill. Another finding was that expansion will increase resources for behavioral health providers by a net of about $63 million annually. And expansion will increase resources for community mental health centers specifically by $17.9 million annually, and that includes $6.6 million that is directly related to the combination of expansion and the new CCBHC model. Next. Some of the other findings of the report were that small psychiatric hospitals and other facilities treating behavioral health conditions are more likely to accept Medicaid in expansion states. So this really speaks to that idea that perhaps we don't have enough infrastructure in place if we were to expand. And what has happened in other states is that the provider community has adjusted to be able to meet those needs. So in expansion states, more providers of behavioral health are allowing or seeing those Medicaid patients. And the final key finding is that federally qualified health centers, or FQHCs, in expansion states average 1,500 visits overall and 1,000 mental health visits per year more than their counterparts in non-expansion states like Kansas. So that part of the infrastructure for providing behavioral health is also expanding in those states that have already made this policy move. Next. So there were some really interesting findings that fall into maybe an indirect category, or specifically looking at the impact on state and local governments of providing expansion as a part of the behavioral health spending that's happening right now. So some of these findings are that expansion is associated with fewer arrests and rearrests, resulting in reduced spending at county jails and state correctional facilities. And that makes sense when you think about what we are hearing, especially this year. There's been a lot of conversation at the legislative level of the cost to, particularly to counties with their jails. and other law enforcement, because there is no other placement in some cases for people who are having a behavioral health crisis, and they end up, because of the behaviors that they're exhibiting, they end up in the correctional system, and that's costing our jails a lot of money. And the counties are having, they really don't have a good way to recoup those funds right now. So fewer arrests and rearrests, it's associated with a reduction in childhood neglect and the number of children entering the foster care system due to neglect. I think this is one that really surprised some of us, but it makes a lot of sense. When parents have their behavioral health needs met, they're more able to be present in the lives of their children and make sure that their children's needs are met. And so expansion states see 32% fewer foster care admissions due to neglect than non-expansion states. And in Kansas, this would have meant 305 fewer children entering foster care in 2022. And when you think about the problems that our foster care system has encountered, particularly in the last several years, and the pressure that's on that system, with shortages of placements, and sometimes we hear about struggles to find placements for children in foster care. Having fewer of them enter into the care of the state would make a huge difference. Next. So I'm going to pass things back to Taylor, and I'm really happy if you have questions to talk about the report more, and I also encourage you to check that out yourselves.
Thank you, April. Yeah, so I can see there's already some questions in the chat. We will go ahead and move on to our Q&A portion of the webinar. I can figure out how to get, and then I will tell you a little bit more about how you can get involved in the movement for KanCare Expansion once we've answered some questions. If my co-hosts would join for the Q&A, I think we're about to have time. Like April said, she had answered a couple of questions with typed response, but we have some more questions that I'll just pose to the group, and whoever is able to answer can do so. So Jim has asked, does your organization have yard and road signs available to distribute in communities to promote this issue? I can go ahead and answer that. We do not currently have road and yard signs, but we do have a lot of KanCare Expansion, buttons and stickers and things like that. I'm sure some of you have seen our t-shirts around the state. So we do have some, merch, so to say, that we would be happy to send you if that's something that you are interested in having. I hope that answers your question, Jim. We have another question. What is the cost of expansion to the state of Kansas? In other words, the federal government contributes $450 million. The state contributes how much?
I'd like to answer that if I can. So there are a lot of savings that would offset the cost for the state. So technically speaking, we have a 10% match rate that we need to contribute, but it ends up being pretty significantly less than that because of all of those offsetting savings. And the most recent fiscal note that I have seen has been around $40 million for a full year.
Thank you. And Cheryl has asked, where do we access the briefing book? I think we had mentioned that.
Yeah, so you just go to our website, which is expandcancare.com. And then in the upper right-hand corner, there's kind of a menu. If you pick Learn More, that'll take you there. And it's just called 2023 Briefing Book on KanCare Expansion.
And Deborah has asked, how does the quest for the flat tax, as used in some other states, affect expansion? Do you have thoughts on that, the flat tax? April, you're on mute.
Sorry. From what I've read about the flat tax, it would actually reduce overall revenues in addition to being regressive and having a greater impact on lower income taxpayers. It also would reduce revenues for the state of, over $1 billion over the next few years. And so I think anytime we look at reductions in overall state resources, a lot of times that means that there's going to need to be cuts. And I think that that could have, a potential impact on some of the programs that are intended to maybe replace the need for expansion. That really doesn't exist. I think expansion is part of the answer to so many problems in Kansas that it really only makes sense for us to move forward with the expansion. But I think that that probably is something that we could see things getting even harder for people who are in the coverage gap if we don't expand. I don't know that the flat tax has a direct impact on expansion.
Did I understand correctly that eligibility for KanCare is 38% of the federal poverty line? Shocking. I would say I agree. And yes, it is. If you make less than 38% of the federal poverty line, you qualify for KanCare under the existing program. And KanCare Expansion would raise that eligibility threshold from 38% to 138%, therefore, covering those who fall into the coverage gap. Thank you for that question.
And I might just add, if you are a childless adult, in other words, you don't have a child under the age of 19 in your household, then you don't qualify for KanCare now, regardless of how little you make. So it just is not available for childless adults in Kansas unless you have you meet some other criteria. So if you are pregnant or if you have a disability that is a disability determination from the federal government, but most adults don't qualify.
Thank you. Ted has asked, do you have a consolidated mail list for all House and Senate legislators? That is not something that we have, but if you visit the same website where you would find the briefing book, you can find our advocacy toolkits, which include a page that has resources for finding who your legislators are. And it's really easy. You just type in your address on openstates.com and it'll tell you who your state and federal representatives are. And you can also go onto our website, and I'll talk a little bit more about this after the Q&A. Our Steps to KanCare Expansion initiative has various contact information for leadership in the Kansas House and Senate, depending on which bill you're advocating for. So we do have some contact information available, but it's also pretty easy to find out who your state officials are, or your state elected officials are, excuse me. So I wanted to be sure to put that out there as well. Becky's asked, have any of the bills made it out of committee? I am not sure if you're referring to KanCare expansion legislation, but we do have bills in both the House and the Senate. It's House Bill 2415 has been referred to the Committee on Appropriations, and Senate Bill 225 has been referred to the Senate Public Health and Welfare Committee. So those bills have not been assigned a hearing yet, but they are in committee. So, that's definitely something to keep advocating for and to keep an eye out for as well. Lori has asked, will there be a link for this webinar that's made available to be sent to others for viewing?
Yes. So when this is done, we'll send out the slides that we've presented to anybody that's registered. And then the plan is to upload this recording to our YouTube channel. And we'll share that out on social media, so you'll be able to rewatch or share it with anybody.
So we have a question in the chat here. Whoops, I lost my place. April, you've marked that you want to answer a couple of questions. I don't know if you just want to speak to some of these points in the Q&A.
Yes. So Mary had said she was talking about the need for a groundswell of citizens in across the state, particularly in districts where there might be opposition. to support KanCare expansion. So you did have some partisan language in there. I just want to clarify that A, we are nonpartisan, and B, there are Republicans who support expansion. But I will definitely say that we need a groundswell of support to overcome the political obstacles in the state house. So we know that somewhere between 72 and 78% of Kansans support expansion, but there's a disconnect at the state house, and conservative leaders have really stopped any meaningful progress of expansion legislation through the system. So I think that, I would absolutely tell you that what we're trying to do is to build a movement that is too loud and too strong to ignore, and your help with that would be very much appreciated. And then the other one was from Senator Petty. And I'm really glad that you prompted me to talk about this. So she mentioned that the cost to the state might be $40 million a year, but aren't there federal incentives that would reduce that? And that really goes back to what we've been calling the signing bonus. So there is federal legislation, or there's a bill on the books that says that any state that newly expands their Medicaid program would qualify for an incentive. In Kansas, it's anticipated that it could be as much as $450 million. And so that would really be enough. It's one-time money. It's not going to be ongoing. But that amount would be enough to support the state portion of expansion for between 8 and 10 years. So absolutely, we would get more help to cover our costs. And the state could also make a decision to use that money for any spending priority that they might have. So it really is truly an incentive and not tied to any one particular thing. But I'm glad I had the chance to talk about that and clarify.
So Jack has asked, are you hopeful that either of the bills before the House and Senate will reach the floor for a vote? Yeah, thoughts on that? That's a good question.
We are a hopeful bunch, Jack. So we wouldn't be doing this if we didn't have hope. I would say we're halfway through the legislative session now. Those bills have not gotten a hearing. We've been told by at least one of the chairmen that he does not plan to provide a hearing for expansion at this point in time. So I think that it's an uphill battle for us, but I think that there's always hope when there is public support for something and a public that's willing to work for it.
We have a question here. Do these House and Senate hearings on expansion ever include testimonies from people from other expansion states or state expansion states, excuse me?
Well, we haven't had a hearing since 2020. And usually what happens is there's very limited time. So the short answer is it has not provided those experiences from expansion states in the past, but I think that that's really meaningful. And I appreciate the suggestion that if we're able to get a hearing, we should make sure to include that. We definitely hear when we look at North Carolina, for instance, they are a state very similar to Kansas in makeup in terms of having a Republican legislature, a Democrat governor, and it looks very much like their legislature has seen the light about the importance of expansion and what it can bring to their state. So I think particularly it would be really helpful to have them share their ideas with our policymakers so that they can collaborate a little bit more and maybe learn from the experience of others.
So Susan asks, doesn't research show that expansion states at least break even or have seen some financial benefits after expanding Medicaid?
Yes. So we even have some research specific to Kansas that shows that because it's for a number of different reasons. One reason that states end up with a net positive after expanding, even though they have that 10% match, is because it reduces costs of things that states are already paying for. But it also brings in a lot of federal dollars, and those federal dollars reverberate in the economy and end up resulting in increased economic activity. So if you think about it, if you have a new doctor or nurse in the community, that's somebody who is buying a house, who is purchasing groceries at the local grocer, is eating at local restaurants, and is, all of those things that generate taxes are being collected, and the state has those as well to offset the cost. So absolutely, we would anticipate that Kansas would bring in somewhere around like between 32 and 40, I can't remember the exact number off the top of my head, but let's say $40 million per year based on an economic impact report that was done by a K-State economist a couple of years ago. And I'm sure that would just increase as the potential dollars would increase.
We have a couple of questions about whether or not it would be possible for Governor Kelly to use executive action to expand Medicaid. Is that something that is possible, April?
I'm sorry, could you repeat that? I should just let you ask. And
no, you're good. We do have lots of questions, so it's helpful. No, there's a question in the chat about would it be possible for Governor Kelly to use executive action to expand Medicaid?
Yes, so it would not be possible. In Kansas, we have a law on the books that passed during the Brownback era that prohibits the governor from enacting expansion through an executive order. We also do not have the ability to bring an issue directly to a vote of the people through a ballot initiative. Our Constitution does not allow for that. So the only pathway we have to expansion in Kansas is through the legislative process.
Thank you. And we have a question here. What is the reason or some of the reasons for refusing expansion?
Most of the reasons that we hear center around a philosophy that government should be small. And so by providing expanded services, services to a larger number of people, we're increasing the size of government. It mostly stems from that. We also hear things that are based on the idea that expansion is something that is provided through the Affordable Care Act, also known even some places in Kansas as Obamacare. And so there's some lasting partisan opposition to something that was passed by the Democrats and former President Obama. We also hear some things that don't ring true to us based on the data and based on the experience in other states. So sometimes we'll hear that this really is bankrupting other states and they wish that they hadn't done it. Well, the answer to that is that this is not a permanent thing. Any state that would want to reverse course most certainly can and go back to not having that expanded eligibility for Medicaid. And no state has done that. So, and quite honestly, when there was an attempt to override and get rid of the Affordable Care Act back in 2017, it was really governors from expansion states that made the loudest noise in Washington about keeping the Affordable Care Act intact. And those were Republican governors and Democrat governors. This is something that really crosses those lines in most other states.
Thank you. And there's a question about what is the estimated cost per year after receiving the federal enhanced match and other federal resources once Medicaid expansion is enacted? How much would Medicaid expansion cost?
That really kind of goes back to what I was, the estimate that I had provided of about $40 million for a full year. But I would also say that in some states, they have created offsetting revenue streams to be able to pay for that. And even in Kansas, the most recent time that we had a serious conversation about expansion in the State House in 2020, there was a hospital surcharge that would have paid for the bulk of that. So I think that there are creative ways that we can bring down the cost, but generally speaking, the amount that the state would need to contribute would be about $40 million. There are a lot of ways that we could do that, including using the federal signing bonus for at least 8 to 10 years, and including having some sort of surcharge that would help to pay for it.
And we have a question here. Is it true that Kansans pay some of the funds to the federal government for Medicaid expansion anyways?
Well, I think that it is true. So, your taxes are not earmarked for one thing or the other, but when we pay our federal taxes, it is going into the federal coffers that then pay for 90% of the cost of expansion in 39 states, including all of our neighbors. So it's not that we would pay less if Kansas, because Kansas hasn't expanded. We're still paying the same amount. We're just not getting the benefit for it.
And does Governor Kelly have the ability to call a hearing in the legislature?
No, unfortunately, that's the legislative hearings are completely under the purview of the legislative branch. And so really that technically, I think that probably is up to each individual committee chair, whether they're going to hold a hearing, but they are appointed by leadership of the House or Senate. And so it often means that if there's opposition at the very top level, then we're not going to get a hearing. And that's what's been happening for the last few years here in the Kansas State House.
We have a question. Do we know how many more votes we need to get Medicaid expansion passed in the Kansas State House?
I think that really depends on how the bill would get to the floor. So if we were to have the permission to from leadership to have a bill go through the committee process, pass out of committee, and make its way to the floor, I think that we would come very close right now to having the number that we would need in the Senate. And I think that we probably would have enough votes on the House side. The problem is that because leadership is not allowing that regular process, if we were to get a bill on the floor, it would probably be in the form of an amendment or maybe a kind of a trick move. And there are fewer people who are willing to put their necks on the line for that type of maneuver. And I don't mean that in a derogatory way. I just mean that it makes a difference if you're free to vote for something, or if voting for something would mean, kind of double crossing your leadership.
And the last handful of questions we have in the Q&A are about, who should we contact about this? So I kind of thought I would lump them together since I'm going to talk about this in our closing. Who is it that we should be calling to advocate for KanCare expansion legislation to receive a hearing this session? So Lacey, would you be able to pull up those slides? So this is how, who you can call, how you can get involved. Firstly, join us as we take the steps to KanCare expansion. Scan this QR code and you'll be taken to the steps to KanCare expansion webpage on our website. This initiative was really designed to make it easier for you to know what's happening with the with KanCare expansion legislation this year and how to get involved in legislative advocacy. Each step includes actions for both individuals and organizations, as well as different social media resources and other advocacy tools that you can use. And part of this initiative is kind of telling you exactly who you should contact about House Bill 2415 and Senate Bill 225, which again are the KanCare expansion legislation that have been presented to the House and Senate. I think on step 2, it'll tell you, who leadership is in the Appropriations Committee on the House side and the Public Health and Welfare Committee on the Senate side. So that, really is helpful in, knowing who to contact about this. But we also encourage you to reach out to your own legislators because, there is a certain level of, influence and rapport that you can have just from being someone's constituent. So we'd really encourage you to keep up with the steps to KanCare Expansion. You can see which step we're on, at any given moment, but also see past steps and kind of get a glimpse of what you can be doing as an individual advocate to speak up for KanCare Expansion. You can go to the next slide, Lacey. We'd also really encourage you to sign the petition for KanCare Expansion if you haven't already. You can again scan this QR code or visit the Steps to Expansion page that I just talked about, and you'll be able to access the petition. I'd encourage you not only to sign the petition yourself, but to share it far and wide. Encourage your friends and family, people that who care about this issue, to sign the petition. We're really hoping to get as many signatures from as many Kansans as possible, so that when we do present this petition to the legislature, it'll be even more robust and impactful. And it's just really important that we get as many signatures as we can on this petition. We can go to the next slide. And another way that you can get involved in advocacy for KanCare Expansion is by attending the upcoming rally for KanCare Expansion at the State House. It'll be on March 15th at 1:15 p.m. In the second floor north wing of the Rotunda. It'll be a really important opportunity to demonstrate how strong the grassroots support for expansion is in our state. Kind of harkens back to some of what we were talking about just now. And the Alliance is also planning to charter a bus to bring advocates to the rally. The bus will be making stops in Wichita and North Newton. So if you're interested in riding on the bus, please sign up as soon as you can, so we can make sure to know how many folks will be on that bus. We can plan accordingly. You can go to the next slide, Lucy. And if your question wasn't answered, or you think of a question an hour from now and wish you would put it in the chat, you can always reach out to the Alliance by email or connect with us on social media. We're Expand KanCare on every platform. And you can also visit our website for more information and to find our individual contact info under the, I think, Who We Are section of the website. You can find our phone numbers and email addresses if you'd like to direct a question to one of us personally. And our website's also a great place to keep up to date on what initiatives the Alliance has going on, upcoming events, things like that. So I wanted to be sure to put that on your radar. You can always reach out to us. This is what we do. We are really passionate about KanCare Expansion, and we're very excited that you all were able to join us during your lunchtime today. And we hope to hear from you all more in the future. We really appreciate your interest in learning more about expansion, and please don't hesitate to reach out if you want to learn more or get more involved in advocacy for expansion. And like Lacey said, we're also planning to post this webinar on our YouTube page and make it available to send to others or to watch again, if you want to get some of the information back out. So it'll continue to be a resource in that way. So keep an eye out for that. With that, have a wonderful rest of your day. Thank you again so much for your questions and for joining us this afternoon. And as a reminder, feel free to reach out if you want more information or want to get more involved. Thank you, everyone. Have a wonderful rest of your day. Bye.